So welcome everyone. My name is Betty Banka. I'm a family physician and I'm a member of the Breast Society of Ghana. And you are welcome. So this evening we're going to be talking about we have a breast health public lecture and we have very wonderful speakers who are going to be talking to us about the various areas of specialty. So let's just spend a few seconds, minutes in an opening prayer, and then after that, the president of the Breast Society of Ghana will give us a short word. So let's pray. Father, we thank you for today. We thank you for waking us all up in good health, and thank you to God of the Father. We pray, committing the meeting into your hands. Pray that we all know and each one will benefit from what we are about to do. Pray that everything will go smoothly. In Jesus' name, amen.
Amen.
So I'll hand over to the President, Dr. Josephine Safo, to give us a short greeting.
Hello, everyone. Welcome to our online public lecture, the first of its kind. We are excited to see you all here. Thank you all for joining in. So the Breast Society of Ghana, we are nationwide and we do quite a few things, but one of our main things is educating people on breast diseases, not only cancer, but about the breast and breast health and breast diseases. And so we are using this as an opportunity to reach out to everyone, all ages, both men and women, though I can see more women online. Please ask your male friends and bosses and partners, everybody to join in. Breast health is for everyone. So you are all almost welcome. And we have some very simple, basic topics that I think every woman should be aware of. So thank you for joining in. I hope you enjoy this program. And at the end, we will tell you all how to join us or just follow our activities. Okay, Betty, thank you so much.
Okay. Madam President, thank you very much. There's a little delay with being unmuted. So anyway, just a quick housekeeping rules. Please let's make sure actually the host is muting us all, so that wouldn't be a problem. But just in case you are mistakenly unmuted, please let's all keep our eye on the mute button so we don't disturb the rest of the meeting. And also, we'll have 3 speakers this evening, and it will be in succession. So please, if you have any questions, you can put them in the chat box. Any burning questions, you can put them in the chat box so you don't forget. And then at the end of the program, when the last speaker speaks, then after the last speaker speaks, then we'll be able to answer the questions. So without much ado, I think I'll introduce the first speaker. She is Madam Lydia Ohenewaa Bampoe, and she's an etiquette and life skills coach, a lingerie specialist, and the founder of Face Fix Oil Blotting Sheets. She is a consultant and a civil servant. So very welcome, Madam Lydia, your audience.
Thank you so much for the opportunity. The time is far spent. We're talking about brassiere fitting and etiquette this evening. Okay, so to quickly go through the agenda again, we'll talk about what we'll define etiquette, and then talk about how bra fitting comes in with etiquette, and then the importance of the bra, the anatomy of the bra, signs that you're wearing an ill-fitting bra, and then key takeaways from this short session. Okay. Next slide. What is etiquette? So etiquette has to do with good manners. Simply put, etiquette has several definitions, and in a social setting or in a business setting, etiquette has various definitions. However, the underpinning principle is making other people feel comfortable by the way you behave. So what you do affects someone else. Do unto others what you would like to be done to you. And then I took a quote from a popular quote from Nina Garcia, which was on the previous slide, about style and how your style makes you, how your style defines you. So bra fitting versus etiquette. Today, you may be wondering, what does bra fitting have to do with etiquette? Your bra, basically, the bra is the foundation of your wardrobe. Your wardrobe is your image. And your image is basically what will make you or unbreak you. 55% of the first impression that you have only 5 seconds to create. 55% is your appearance, 38% comprises of how you speak, and only 7% is the words that you speak. So your appearance is very important, and your bra is the foundation of your appearance. So let's talk about the importance of a good bra. A good bra will give you comfort, especially with our sisters who have been blessed in the chest. If you have a good fitting bra, your bra, it spreads the weight, a good support. It will give you good support, and then also spreads the weight so that your shoulders are not carrying too much in the straps. And then secondly, your posture. If you have the right bra, as in the previous slide or in these with these two images, you can see that you can stand upright. Your self-confidence, it defines you. A good underwear, very good underwear, good fitting bra defines your self-confidence. And again, as I said before, will make or unbreak you. Youthfulness, you wonder why I added youthfulness. The farther your bra is, your breasts are to your waist, from your waist, the younger, taller, and slimmer you look. So if you wear a bra that your straps, the bra is too big or the straps are not well fitted, your breasts will then move towards your waist, and then you look like you don't have a waistline. You don't look heavy. You don't look younger. You look old and you look sluggish. So your undergarments are very important, and your bra constitutes the foundation of your wardrobe. Just imagine a tall, a building, a beautiful building that has a beautiful building built on a wrong foundation. The building is tilted. You see how beautiful the building is, but you can't make much of it. And it doesn't look good to you because it's tilted on the wrong foundation. Same way, if a lady is wearing the wrong bra, or you are presenting to an audience, your bra is pinching, you can't even focus on your audience. You can't focus on what you have to do. You can't present yourself in the best manner possible. Okay, so we'll talk about, can we go to the previous slide, please? Okay, so in order to get your foundation right, I want to talk about the prerequisites for building a good bra foundation, a good bra wardrobe, which is your foundation, self-worth, and then understanding the anatomy of the bra. With self-worth, next slide, please. With self-worth, what I like to say to most women, when I was a lingerie seller years ago, of course, I still consult in lingerie. I'm a lingerie specialist. However, I used to tell my customers then that do not tie your self-worth to your bra size. Because some women feel if they go for a bra fitting, first of all, they'll avoid a bra fitting, or they come for a bra fitting and then they argue with you when you give them the right size. Some people say they cannot hear. I'm looking at the chat. Can everyone hear? Okay, right. So some people avoid bra fitting because they think that if you like going for a diagnosis from a doctor. So if you go to the bra store, the lingerie store, and you are fitted, and you're told that you're 40, for example, 40 triple D. There are some people who condemn themselves that, oh, now I'm no longer a B cup. I used to be a B cup. Now I'm a triple D cup, so I'm condemned. Guess what? There's bra sizes from A to J cups, even beyond J cups. There's a bra that fits everyone. So self-worth is very important. You must understand, you must know your body, and you must understand that a bra is worth investing in. A bra is a good investment. There are so many flimsy bras on the market, but you must make it important to get a good bra and understand that a good bra, a $20 bra can make $100 outfit look cheap, whereas a $100 bra will make a $20 outfit look like $1 million. And you cannot compromise with the bra fitting. You must get fitted once a year, at least. Or if you have drastic weight loss, or you've just had a baby, or something has changed about your body drastically, then you have to get fitted once, more than once a year. So next we'll move to the anatomy of the bra. What do I mean by the anatomy of the bra? If you're buying a bra, it's not just about the beauty of the bra. You must understand what's the different components of the bra, the different ways the bra is engineered, and the parts that are most important to you. First of all, the band of the bra. The band of the bra gives the woman 80 to 90% support of your breast, aka the girls. You cannot support your bra with your breast with the bra straps. The band is very important. Always remember that, as in the picture, a big bra band equals more hooks and equals more supports. So a big bra band will give you the smoothing effect under your clothing and also give you the right support. The straps, second is the straps. The straps are very important, but only gives you 20%, gives your breast 20% of the support. Let's, as much as possible, not try to support our breasts, however big or however small, from the top. The straps are there for adjusting the fit of the bra. Not more often than not, one breast is bigger than the other, and so there may be a gap in one of your bra cups, and so it's the straps that you use to adjust the bra to give you that support. The cups, there are different types of cups. There's the lined cups, the unlined. Most balcony bras have no lining, and a lot of women shy away from the lined ones, like the t-shirt bra that has no padding. It gives you shape, it gives you support. There's actually the bras that the cups that are padded, which are known as the push-up bras. So everybody must have a t-shirt bra. It's molded, and it shapes the breast and then gives you the lift. The under the breast, under the bra, the underwire is also another very important aspect of the bra. When you're buying a bra, that's what you should look out for. There are some, most of the time it's made from metal. There are a lot of myths about the underwire. So today, there are so many bras on the market that have no wire, and they are also perfectly good. But if you're buying a bra with the underwire, make sure that it has a good support and it fits right. The center panel, or the gore, is what sits in between the two breasts. It usually has a decorative piece, or the logo of a brand. And that must also lie flat against the chest. These are the 5 important aspects of the bra to look out for. I'll talk more about it as we go further along. So signs that you're wearing an ill-fitting bra. Okay, so first of all, when your straps slide off your shoulder, you know that your bra is wrong. There's a few instances where a woman has narrow shoulders, so her bra straps will slide off her shoulder. She will either tighten the bra straps, or she can wear a racer back. So those are specialty bras. So she wear a racer back bra because she's narrowly built, and so the bras on the market are wide. They have the straps wide apart. If the gore of the bra doesn't lay flat, the gore, as I said, is the center panel. If it doesn't lay flat in between the breasts and the two breasts and is hanging, then you know that you're wearing the wrong bra. And that can also hurt you. If the wire, the underwire hurts, if it pokes your armpits, then your bra cup is too big. If it pokes your breasts, then your bra cup is too small. These are key takeaways from that. Also, can we go back to the previous slide, please? Okay. When the band, your bra band moves around a lot, then that also is an indicator that you're wearing the wrong fitting bra. When you lift your hands above your arms above your head and your bra moves, your bra band moves, then you know that you need a fitting and you need a new bra, because it shouldn't move around. If you have back fat, or your bra band is too tight or too loose, then the flesh collects at the back. Those are signs that you're wearing an ill-fitting bra. As in the picture of the lady in the white bra, you have 4 boobs. So your cup is too small. And as they say, your cup overfloweth because you're wearing small cups. Sometimes, we are all guilty. We go to the store and we pick a bra because it's beautiful. We don't even think about the sizing. But you need to think about all these things. You need to understand this, the shape of your breasts. And there's no one size fits all. For someone, it can be a minimizer. For someone, it can be a standard, a t-shirt bra that works for you. So there's no rule that says this is the bra to wear. You must know your body. And that's why I was talking about self-worth and loving yourself. When the underwire is poking you, which I said, if it pokes under your arm, then the bra cup is too big. If it pokes on your breast, then the cup is too small. Okay. Next slide, please. So the bra staples. What bras should every woman have in her bra wardrobe? A t-shirt bra, which I said again is not a padded bra. It's the bra that will prevent your highlights or your nipples from showing, from being displayed. Some people have very thick nipples, so a t-shirt bra will work for you. It's not a molded bra, so an F cup, somebody who is a G cup or an F cup should not shy away from wearing a t-shirt bra. It's just lined. It's got extra lining. A minimizer is a bra that is commonly used by those who are well endowed, those who are blessed in the chest. So a minimizer will compress the breast tissue or prevent the projection of your chest by probably another 2 inches, minimize the projection of your chest by another 2 inches. Every woman must have occasion bras. Depending on how often you go out, depending on your lifestyle, you must have a strapless bra, a good strapless bra. And they are big investments. They don't come cheap. A good strapless bra, which must hug your torso, and inside the bra strap, look for the silicone bands that hold the bra up, that will hold the brassiere up. Some people react to it, so they get skin rashes and stuff like that. But otherwise, those are signs of a good strapless bra. If you don't use them often and you think it's too big an investment to make, buy a convertible bra so that you can use as an everyday bra and then take the straps off when you need to wear that. There's also the long line bra and the multi-way bra. So those are occasion bras. So every woman must have a t-shirt bra or a minimizer, occasion bras like a strapless bra, and then activity bras like the sports bra. And that also depends on how often you work out. At least have one, so that if there's a group activity that you have to do with your office, with your church, you have the right bra to use. Okay. Okay. Now, we've talked about the bras. You've talked about what bras you can get. This is all building the foundation. Now, when you make the investment, you must care for your investment. And more often than not, we don't think about how to care for our bras. We just shove them in the washing machine, or we just wear them too often. These are a few pointers to note. A every woman must have an everyday bra, which I talked about. You must have, for your everyday bra, you must have at least 3 of them. Occasion bra, you can have 1 of them. Activity bra, depending on how often you work out, you can have 2 or 3. But your everyday bra, which is either your minimizer or your t-shirt bra, depending on the size that you are, you must have 3 to 5 of them. And do not wear the same bra 2 days in a row, especially in the temperate climate, because once you wear the bra, you go out in the heat, whether you're in the winter or you're in the summer, your body heats up, the bra, and your body expands, the bra stretches. When you take off the bra, it must cool off, first of all, to get the odor right, to freshen it up a bit, and then it must shrink to, or it must go back to its original shape. Okay, so once you have 3 everyday bras, at least you can wear 3 bras in 5 days. And then wash each of your bras after 3 to 5 wears. If you're in a cold climate, after 5 wears, you can wash your bra. But if you're in the temperate climates, after 3 wears, you must wash the bra. And then you hang them with the center panel on the drying line, or you lay them flat, so that the weight is evenly distributed. Otherwise, you destroy your bras in a very short time. At least the life cycle of each bra, if you have the right number of bras, should be a minimum of 18 months. Okay, and then stacking your bras, packing the bras also. Do not do the flip and flop, where if you have a big bra, you fold one cup into the other, lay them flat, just like they're stacked in the shop. Otherwise, you damage the cups of your bras. Okay, and then wearing the bra also, you must always wear your bra. I mean, I'm guilty of that. They say we shouldn't be twisters and hookers. So that's what we all do. We twist the bra to the front, and then hook it up and then twist it back. You destroy your bra, or you shorten the life cycle of your bra. You should put the bra on by putting the bra on the breast, and then putting your arms through the straps, and then hooking it from the back. A lot of women will say, I cannot hook my bra from the back, but you can unhook it from the back. So yes, you can hook it from the back. So I think going forward, everyone should try doing that to keep your bra for a longer period. And that is how to, in short, that's how. And to add on to that as well, once you've hooked and you've worn the bra, you should do the hoop and swoop as well. So many terminologies, but you take your right hand into your left cup and your left cup into your right cup, and then distributes the spread of the bra, especially with your strapless bra. Otherwise, it doesn't sit right on you, and then it affects how your garment looks on you. So I hope that I have been able to talk through, to tell you about the importance of a bra. We couldn't go through bra fitting, but there's so many shops and on the internet as well. You need 2 measurements when you're looking for your bra measurement. The measurement under your bust when you have your bra on, and then on the fullest part of your breast. Those 2 measurements, you can go on any bra fitting website or any departmental store website, put the details in, and then you get your bra size. But make time for yourself, love your body, know your breast shape, know your breast, know your body, know what works for you, and get fitted at least once a year. Thank you very much. I hope I've been able to inspire you to get your bra groove on.
Hello? Okay, thank you very, very much. We've learned a lot. I actually was taking notes. So thank you very much, Madam Lydia. We've learned a lot, especially the bras that we are supposed to have. We all need a t-shirt bra. We need a chest minimizer. We need occasion bra, activity bra, and all that. Thank you so very much. So I think I'm sure there'll be more questions after this. Let's introduce our next speaker. Our next speaker is Dr. Sandra Korsah, and she is a clinical oncologist at KATH, an alumnum of SMS, KNUST, a member of the Ghana College of Physicians and Surgeons. Her interest is in breasts, GIT, and prostate cancer. She's a devout Christian who loves listening to music and watching movies and spending time with her friends and family. So very welcome, Dr. Sandra, your audience.
Hello? Hello. Good evening. Please, can you hear me? Okay, I'm sharing my screen. Okay. Please, can you see my slides? Please, can you see my slides? Hello?
No, please, we can't see
Hello?
No, Doc, we can't see your slide.
Okay, let me do it again.
I reply, okay. Okay.
Is it showing? Hello, is it showing now?
Yes, please, we can see it now.
Okay, thank you very much for that kind introduction. So let me put it on slideshow. Okay, so tonight we'll be talking about the myths and misconceptions about breast cancer. And the myths are many, but we are just going to focus on the ones relating to the bra and then the breast itself. So before we start, I want us to understand some key words in the topic. So we want to know the definitions of the myth and the misconception. So what is a myth? A myth is a widely held but false belief or idea. And a misconception is a view or opinion that is incorrect based on faulty thinking or understanding. So simply put, our topic, we are going to talk about false ideas about breast cancer. So I put down about 10 myths. There are many, so I just had to do a few because of the time I was allocated. And as I said earlier, we'll just focus on the bra and the breast itself. So the first myth I want us to talk about is wearing a bra can cause breast cancer. That is very false. There's no data or scientific evidence supporting that. I want us to look at the second myth and then I'll do some explanations to that. Then the second myth talks about bras with underwires causes breast cancer. I'm sure this myth, most of you have heard of it. But currently, as I'm speaking, there's no scientific evidence supporting that ideology. And I think the explanation or the reason why people think or believe that bras or bras with underwires are likely to cause cancer is that they say the bra would obstruct the flow of lymph. So lymph is a fluid that runs in the lymphatic vessels that carry our immune cells. So they look, let's take it similar to like a blood vessel which carries blood, but the lymphatic vessel carries the lymph. So they state that the bra or the underwire will obstruct those lymphs, so the fluid cannot flow with ease, and that will cause a accumulation of toxins in your breast tissue and will lead to cancer. No scientific data or no scientific analysis show that a bra wire can obstruct your lymph vessels. It doesn't do that. The worst it can do, as Miss Lydia spoke in her presentation, if it's not well fitted bra or is very tight or too loose, the underwire can poke you or irritate the skin. So what it will do is will just lead to cracks or bruises on the skin. And then it is a gateway for germs or bacteria to get into the breast and cause an infection, inflammation. And mind you, the signs and symptoms of inflammation or infection from the breast can look similar to breast cancer symptoms. So the swelling, the reddening, the pain. So you might think it was a cancer, but it was never a cancer. So it will never do that. Some people even say that if you don't wear bra, you are not going to get cancer. That statement is also false, because in studies have shown that women who didn't wear bra or who wore bra, it didn't make any difference in causing them to have cancer or not having the cancer. The third myth I want us to look at is using antiperspirants and deodorants. They say it can also cause cancer. They even say that if you shave and then you use these deodorants or antiperspirants, it even worsens your case. Yeah, that means the cracks in the skin from the shaving will even worsen or cause the chemical that is found in the antiperspirant. There's a chemical called aluminium that usually they use in making the antiperspirants. The purpose for that chemical is to prevent sweating. So what is that? It does is that the aluminium will dissolve on your skin, will get into the skin, especially the armpit area, then will block your sweat glands so that you do not sweat. Unlike deodorants usually don't have the aluminium, but they will just mask your body odor. They don't prevent sweating, but the antiperspirant will prevent sweating. So that aluminium chemical, they claim it's toxic, and that when it gets into your breast tissue, it will cause cancer. And that when you shave and there are cracks or bruises, it will cause a higher rate of absorption of that aluminium. Some products can behave as both as a deodorant and an antiperspirant. So for those ones, they will contain the aluminium, but if it is solely a deodorant, it never contains the aluminium. So as I said, it's not true. The aluminium chemical is not one of the causes or triggers for breast cancer. It doesn't do that. And then the fourth myth I want us to talk about is carrying a phone in your bra. You know, our mothers, they like tying their money, and some people put their phones because they think that place is the safest place to keep your treasure that nobody will take away from you. And people say that there are some radiations that are emitted from the phones. Yes, the radiations are usually like radio frequency waves. Those waves are very low energy level. Before a radiation, any form of radiation or radioactive wave can cause cancer, it must be of a certain energy level. It must be of a high energy level. They call it ionizing radiation. But for the waves that come from the phone, they are non-ionizing radiation. They are very low energy levels. So those waves cannot damage your breast cells to lead to cancer. But just that for hygienic purposes, I think you should find a better place to keep your phone or your money. Then the fifth point or myth that I want us to look at is people have the perception that breast cancer only meant for older women or middle-aged women. In the past, that's what most of us thought. But currently, the picture is not like that. we have very young women too, especially women under 45 years, or even sometimes 35 years, are having breast cancer. A study was done in one of the teaching hospitals in Ghana, and it looked like about 13% of 13% of the women that had breast cancer were below 35 years. And I have personally managed patients in their early 30s who had breast cancer. So I just want us to take that out of our mind so that we don't dismiss any symptom or sign we see that, oh, for this one, she's too young, so it cannot be breast cancer. So you're not going to seek medical care. So irrespective of your age, you are at risk. And that if you see any of the symptoms of breast cancer, you need to report for medical care. And we always forget to add the men. The men too are at risk, but just that the rate or the proportion is very low, usually about 1%. Sometimes the whole year, you just see 1 or 2 males who come with breast cancer. And the sixth myth is breast cancer is more common in women in bigger breasts. But the fact is there's no connection with breast size and cancer. Breast cancer is not a respecter of breast size. It doesn't matter how big or small your breast is. It doesn't change your risk of having a breast cancer as a woman. But however, for those with a very bigger breast, the issue with them is that in self-examination, because the breast is so dense and voluminous, in their examination, probably they will miss certain parts when they are palpating. So if the lump is so small, they're not likely to pick it and they will miss it. So before they will realize that they had a lump, then probably it's bigger or it's more advanced. So that is the only disadvantage there. But you having a bigger breast or you having a smaller breast does not add to your risk. Then the seventh myth I would want us to look at, this one was really funny for me. It says that if your baby belches on your breast, you can get cancer. And I was like, what at all is in the baby's vomitus? It's just breast milk, and the breast milk was produced in your breast. So if anything, then your own breast milk should cause the cancer. What at all will be in the baby's whatever came out of the mouth can cause the cancer. It's not true. There's no scientific analysis or data supporting that. And the eighth myth I want us to look at, they say a breast injury, or if your male partner suckles your breast, you can get breast cancer. That is very false. It does not do that. The thing is probably because of that injury, probably your mind will be drawn to looking at your breast or examine. Let's take some people. I've heard so many times people come to the consulting with stories like, oh, then my breast hit a table or hit something. That's when I got the lump. It's not the trauma that brought about the lump. Probably the lump was already there. She didn't notice it. It was because of the trauma that she decided to look at her breast or even touch her breast. And then she picked that lump. And with your partner sucking your breast thing, that one, there are two ways, there are two sides of it. There's a positive side, it's a negative side. The positive side being that since if your partner is the type that suckles your breast, handles your breast, he's familiar with how your breast is and how it feels. So if there's any slight changes, he's likely to notice it and draw your attention. So that means that you'll be able to detect it early. And we all know that early detection improves your survival when it comes to breast cancer. The negative side might be that if he doesn't handle it well, maybe he bites on it too hard, it can create some cracks or bruises, and so it gives way for germs to get into your breast tissue to cause infection. But that is all. It has nothing to do with breast cancer. And the last but not the least says that breast pain is a definite sign of breast cancer. It's not true. It will amaze you that most of the breast lumps that are related to cancer are painless. Usually at the beginning, they are painless. So that's how come most of the women feel like, oh, so they don't really bother about it. And I say, oh, it's only when they start having pain that they want to report it. And usually for you to start having pain, probably would have been advanced or ulcerated, like has become a sore, then the pain will set in, then you want to report it. By that time, it's way too advanced. So as I was saying, most of the breast masses that are malignant might not come with pain. So if you have pain in your breast, don't just conclude that, oh, I have cancer and be so worried about it. There are so many breast conditions that come with pain, like inflammation, abscess, and the likes. They all come with breast pain. So if you're having this persistent, even sometimes our normal menstrual cycle, we have this cyclical pain that comes with it. So if you are having a persistent pain, is increasing in severity, you just go to the nearest hospital to be checked and then find out what exactly is going on. And then my last myth that I want us to talk about is a lump in your breast means you have breast cancer. It's not all breast lumps that are cancerous. As I said, there are so many breast diseases that exist, and that they also present with a mass or a lump or a feeling of something in the breast. So the best way to be sure that you are dealing with that or this is to seek medical care, so the appropriate test, which is a biopsy, will be done to confirm or rule it out. So, as I said, the myths are mainly, we just concentrated on the bra and the breast itself. But there are other myths around. But with every information you get, it's important that if you are in doubt, you discuss it with the medical personnel, or read on it or research it before you decide to believe and hold it dearly. Thank you. Thank you.
Hello. Thank you
Hi.
so very much, Dr. Korsah. Unfortunately, I have Doomsaw over here, but I'll try and get through. All right, thank you very much. So our next speaker is Madam Jacqueline Oduro Akoto, and she's a registered nurse with the Ghana Nurses and Midwives Council with over 10 years experience in surgical nursing and primary focus in breast cancer care. Her interest and expertise in breast care was honed during her time at the Surgical Breast Oncology Unit of the Kolebu Teaching Hospital, with certification in breast care nursing by the NHS, James Paget University Hospital Foundation Trust, blended online learning UK. Currently works with Ghana Health Service at the Tema General Hospital as the principal nursing officer. She is passionate about creating awareness, providing support, patient advocacy, and continuous learning to improve patient care outcomes. She is a dedicated member of the Ghana Nurses and Midwives Association and working member of the Breast Society of Ghana, and also serves in the research and screening and outreach subcommittees for screening and outreaches. So, Madam Jacqueline, you are very, very welcome, your audience.
Thank you so much, Madam Betty. And hello, everyone. A very good evening to all of us. I'd like to talk briefly on my presentation is mainly on breast examination. And it's a key aspect of breast health, mainly because I feel it's one of the game changers for early detection of the varied breast diseases. My presentation this evening is really short. It's in two folds, actually. This one, it's a prelude, more like a prelude to the actual content of the next presentation, which is a detailed demonstration of the breast examination, or how to examine the breast. Yeah. So I've always believed that having an upper knowledge on a particular topic always gives you a better idea or you fairly appreciate what it is. And so I agree with what Thomas Jefferson said, and I quote, knowledge it's power, knowledge is safety, and knowledge it's happiness, unquote. Now, the purpose of breast examination this evening is mainly to empower us women and men as well to take charge of our breasts. Basically, to know and understand how a normal breast is, or what a normal breast is versus an abnormal breast. Now, the trick is to know how your normal breast feels or looks like, largely depends on how regular you examine your breast. An examining of your breast is a key aspect of breast health and your overall general well-being as well. Now, examination of the breast really it's key because it helps you identify changes in the breast earlier and subsequently improve your health outcomes. Now, it is necessary that we prioritize breast examination or screening so that we can always catch these changes early and then we get it sorted. It is essential that you don't wait for any sign, don't wait to see any changes in the breast. Just get your breast examined. The breast examination is in two parts, or there are two kinds of breast examination. The first, which is the woman examining her own breast, which is the self breast examination. Now, oftentimes as a nurse, I get the question of what am I really looking out for when I'm doing the examination? I don't really know what I am doing. And if I feel a lump in the breast, how does it really look like or feels like? And so I am hoping that at the end of this presentation and the video in entirety, all these questions would be answered. Now, the recommendation for women who are menstruating or premenopausal women, the best time is 5 to 7 days after your menses, where it's assumed your breast has gone back to its normal state, when the breast is less likely to feel pain or heavy, then it's more comfortable to do the examination. For postmenopausal women or women who are done menstruating, it's advisable you pick the same regular day each month for your examination. So it should be a day that easily comes to you. You can easily remember. It can be the first day of each month, any day that you don't struggle to remember. So at least you can keep tracking and you do your regular examination. The second aspect of the examination is the clinical breast examination, which is the physical examination of the breast by a healthcare professional. Now, the clinical breast examination is mostly used in our settings, and sometimes it's seen as a screening tool for breast screening or breast cancer. However, I would like to stress that it does not replace mammography. And so for screening purposes, it's advisable that once you get your clinical breast examination done, you should have a mammogram done as well. Now, the recommendation for women who are less than 40 years or between the ages of 20 to 39 years is to have the examination done every 1 to 3 years. For aged 40 years and above, then you should have it done once a year. I believe that this approach significantly help to also detect a mass or a change in the breast as early as possible, and then you can get it checked out. Yes, so the mammogram. So with mammograms, it is the ideal tool for breast screening, and it's recommended because the mammogram is quite sensitive and can sometimes pick changes in the breast earlier before it even becomes a cancer or any disease that um, may affect you in a way. And so it's advisable that for women who are 40 years and above should have a mammogram done once a year. For people who have family history or have positive family history or have a higher than average risk, that is to say that they have a family or a close relative diagnosed of breast cancer, or they have the mutated gene, they advise that they get their screening earlier before 40 years. And so, for instance, if a parent is diagnosed of breast cancer at the age of 45, then the woman should have her screening done 7 to 10 years earlier. That is between 35 to 38 years. Or you seek consult from your doctor. Now, regular screening really is significant with mammography, just as I said earlier, because it can catch breast cancer earlier or breast changes early, improves your overall care outcomes and survival rates. Yeah. And so, unfortunately, my presentation it's really short, but I believe that we would stay and then watch the video till the end, because that is where we'll get all the proper examination or the right way to examine the breast. And so, in conclusion, I would like to say that we encourage all of us to make examination a routine thing. We should include it in our practices, our health checks, because in breast health, examining your breast is also key, not just admiring them alone. Now, let's also increase awareness, create more awareness on breast examination so that we can all be on the same line. Thank you all so much for your attention. And then we'll stay and watch the video, a step-by-step video on breast self-examination and clinical breast examination. Thank you so much.
Hello there. Today we are talking about something really important in relation to breast health: breast self-examination. Now, why is this important? Breast cancer is one of the most common cancers affecting women. But the good news is, when detected early, it can be treated and increase your survival. It's important to note that breast self-examination is not a replacement for breast screening, which involves mammograms and clinical breast examination as well. but it is a good way to be breast aware and identify any changes early. The problem is many women may be doing it incorrectly, potentially causing you to miss a lump or an unusual change. Good knowledge and skill are essential for breast health. There are simple steps and techniques you can do at home to know your breast and to help identify any unusual changes early and get it checked out. Step 1. Stand in front of a mirror and expose the upper half of your body to look at your breasts in the mirror. With your shoulders relaxed and your arms at your side, turn and look at your breasts in the mirror. Raise your hands high above your head, also look in the mirror. And then put your hands on your hips and press down. Lean forward gently and look for any changes in your breast. Look for changes in the size and contour of your breast. Look for a change in the skin color. Look for a rash, a sore, or a dimple in the skin of your breast. Pay close attention to your nipple. Look out for any change in direction of the nipple from what it used to be, or any fluid that is coming out of the nipple. Step 2. Feeling the breast. You should use the flat surface of your fingers to examine the breast. Place your right hand behind your head and use your left hand to examine your right breast. When you are done, you will swap and place your left hand behind your head and use your right hand to examine the opposite breast. So you should use firm pressure to examine your breast in circular motions. You should cover the whole breast, moving around to feel for any unusual lumps or thickenings of the breast. Don't forget to examine the parts of the breast under the nipple. You may also go in an up to down fashion. Just make sure that you cover the whole breast from top to bottom and the side parts of the breast. A lump will feel like a small pebble or granite or a knot. Anything noticed should be reported. And then you should express your nipple for any unusual discharge. A little whitish or creamish discharge is okay. But if it looks bloody or you're getting a lot of discharge, you want to report this. Finally, remember to examine your armpits. You want to dig deep in your armpits with your fingers, feeling for any unusual lumps. You must do this in both your armpits at the end of the examination. Any abnormalities in the breast or armpit should be reported to the nearest health facility. And that's it for a breast self-examination.
Hello? Okay, sorry about that. We are having quite a technical challenge this evening, but I think we've all learned so much today. And I think we'll have a few seconds for a few minutes for questions. So if you have any questions, please just indicate and then I will call you and you can ask your question. Any questions? Okay, so Heleta has a question. Heleta, please unmute and go ahead. Hello?
Please, can you hear me?
Yes, go ahead.
Thank you very much for the education. And then participate. You can have a mammography screening if you are below 40 years.
Hello? Please, hello? Please, all others, please mute. Please mute if you are not talking. Please mute. Okay, all right. I think we might just.
Yes, you yourself, you're muted, Betty. We can't hear you.
Go be in the newspapers. All right.
I know you can fulfill all my dreams, except this, because my very fate is my enemy.
All right, Heleta, you can go ahead and ask your question.
Now I will never be able to shape my future with my hands. Yes, so I'm asking if you can have a mammography screening below the age of 40 years. What are you saying, Mother? I've already hurt myself.
Augusta, please mute.
Take trials through your contacts.
Augusta, please mute.
Keeps the hot shot. And now I'm unable.
Hello, Augusta, please mute.
I will do anything at all for my sister. I will buy anything. Your photo will be a newspaper.
Okay, I think that
the one who ensured
it. Mute her. Okay. All right, Heleta, go ahead.
Yes, so I was asking if you can have a mammography screening below the age of 40 years.
Okay. All right, let's take another question and then Dr. Ansafo is here. Okay, so Sandra can also. Yeah, Sandra, you can go ahead and answer the question.
Okay, so usually younger women have dense breasts, like what we say in latent, maybe it's more full than older women. So mammograms are good for those with a less dense breast. So for a younger woman, I will recommend ultrasound of the breast for you.
Thank you very much.
Okay, so Eva Geraldo has her hand up. Please go ahead, Eva. Host, please unmute Eva so she can ask her question.
Thank you
Okay,
for
go
the
ahead.
presentation. Please, I must admit I've learned a lot, but sorry I missed the part that spoke about the myth. And if there's anything that was earlier discussed about brachial hair, can I please get a repeat of it? Thank you very much. Thank you.
Okay, you're welcome. Abba is next.
Okay, so mine is actually to ask if you would share the recording at some point. I mean, how do we get it to go over it? I missed a bit of it.
Okay, so we'll talk to the powers that be and see how that would work out. Okay. All right, and then we have so Abba, that your hand is down, right? Any other questions? I just wanted to make a point that sometimes one of the myths that we hear a lot when we do breast education is that some studies have shown that breastfeeding is protective against breast cancer, and it's because of the sucking. And so some men come up and say that, well, so if I suck my wife's breast, am I protecting her from cancer? Dr. Korsah, do you want to address that, please?
So, as I said in my slides, the sucking is not what is going to stop you from getting cancer or reduce your risk from getting cancer. The only positive side is going to help in detecting it. Because as I said, the males probably they know your breast well, they know how it feels and how the consistency. So if there's any slight change in that, they will notice it. So then they will encourage you to probably go for an examination or see the doctor. So in that way, they are helping you to detect any early cancer. And we know that when there's early detection, it improves your survival rate. So that's like the positive side, but not necessarily that it will prevent cancer from occurring. This I hope is clear.
Yes. Okay.
Thank
So
you.
the next one is Vida Frimpong. Let's go ahead.
Please, I want clarification on something. The presenter said after 40 years, you do mammogram. But in this case, you do the mammogram and you are told to go back and do ultrasound. So I don't get it. I thought the mammogram is the fastest way to identify a lump, breast cancer. But you go do mammogram, and when the result comes, they'll tell you to go and do ultrasound scan. So I want clarification on that. Thank you.
Okay. Dr. Sandra.
Okay, so when it comes to imaging modalities, they all have their, let's take their good side and their bad side. So usually ultrasound do better like in viewing lymph nodes in your armpits. As I said, there are lymph vessels coming from the breast towards your armpit. So sometimes when the cancer occurs in the breast, it can spread to those nodes and they become big or they feel big. So definitely there are certain things that ultrasound can see better than mammogram can. So if they need some clarity, then they want to do maybe an add-on ultrasound to make sure that they are sure what they are dealing with.
Okay. I hope Vida, that has answered your question, because when you have a mammogram, basically the picture that was shown, you'd have to, put the breast under the machine. And if there are some lumps or anything like that in the armpits, it's the ultrasound that can pick it up, because we can't use the mammogram to be able to pick up those lymph nodes in the armpit. So that is probably why we ask you to do that. Okay.
Thank you.
You're welcome. Any other questions?
So please, I want to ask, how often do we do the mammogram when you are above 50?
Okay. Yearly, once in a year should be okay. So
Okay.
you do your monthly self-examination, and maybe once in a year you do the mammogram. But if let's say you do your monthly examination and you find something, we can do a mammogram, even though probably you have done it earlier on in the year. But if everything is fine, I think once in a year is okay.
Okay. Thank you.
Is Madam Lydia Mpere? Your hand is up.
Yes. Good evening, everyone. So my question actually has to do with women and the fact that sometimes we want to enhance our breasts.
Mavis, please mute. Okay. Go ahead, Lydia.
Okay, so I wanted to know the relationship between actually enhancing our breast. First of all, does enhancing our breast, as in we think that our breasts have fallen, as we usually say in our local palace, may not fall at all, and all that, enhancing it and the effect or any correlation with breast cancer. If not, what are some of the enhancements that we can do that is healthy and is not likely to expose us to adverse effects?
Okay, so let's get 2 more questions, and then Dr. Korsah can answer them. So let's have Abimbola go ahead and ask your question.
Good evening, everyone. Thank you, doctor. Thank you for all the information. This has been so worth the while. Thank you so much. Yeah, for me, it's I've had hyperlactemia for a very long time while I was still a teenager, and it's it's an hormonal challenge for me, and doctors told me that I will probably not have children, even though to the glory of God I have babies now. So, but now I still have the breast, I still, should I say lactate now? I've still having children, so I still have that. So, when you're talking about, having self breast, I don't know the word for it, and I still have the discharges. So, I don't know if I have that, should I be worried? Should I be concerned? Thank you.
Okay, so thank you. We just have one last question, and then Dr. Korsah will answer them, and then we will call it an evening. So, Madam Esther, here you are. Please go ahead and ask the question.
Okay, good evening, Doug. Please, I would like to ask, is it advisable to do any of the tests you mentioned, the ultrasound scan or the mammogram, for a teenage girl who is busty? Thank you.
Okay, so we have 3 questions. Dr. Sandra, please go ahead and answer them, and then we'll wrap it up.
So I think the first question was talking about breast enhancements. The first question was about breast enhancements, but the second question I didn't really hear. So I'll go with the first one. The first ones, when it comes to breast enhancements, there are ways of doing it. Some do it surgically, some take supplements, some do exercise, just strengthening the muscles, the chest wall muscles, to make the breast in normal man's terms stand. But so far, there's no scientific data showing that if you do a surgical procedure to enhance your breast or exercise would increase your risk for breast cancer. We don't have any scientific data yet. I don't know if in future we will get, but currently we don't have anything like that. That's of course. But I would advise that if you want to go for breast enhancement, you should seek a professional, somebody who has expertise to help you so that you do it right and well. So please, the second question, I didn't get that. I didn't hear anything actually. So I don't know what's the...
Okay, can you hear me now?
Yeah.
Okay, I was saying I had hyperlactemia. I had hormonal challenges from my, teenage years. I had I was lactating anyway before I even got pregnant, before I married and all that. So I was so several years. I mean, for a very long time, I was on treatment and I was told I won't be able to have children. And like I said, I have children now, but I still have those discharges. So I'm asking, should I be concerned? Should I be worried? Because I'm sure that when I press it, I don't press it regularly, but it says I'm sure that when I press it, I'll have, the discharges still coming out. So I don't want to call it discharges, but breast milk still coming out. So should I be concerned? That's my question.
So if I got you right, you're saying that your breast, you are like having a breast milk discharge, something like that, even before pregnancy and still after pregnancy, something like that. Okay.
Yes.
So in our body, most of body is controlled by certain things that in our body is controlled by, especially when it comes to women's health in terms of our menses, when we get pregnant, how we can sustain pregnancy or even breastfeed. They are all controlled by a certain chemical called the hormones. So for the woman to produce breast milk, there's this hormone called the prolactin. So if there's an imbalance or there's no regulation in that, then there's something wrong with the hormone production. Either you're producing too much or whatever is supposed to inhibit its production is not working. So further tests have to be done to check your prolactin levels. If they are high, we have to find out why they are high. So because the prolactin hormone comes from the organ that's responsible for producing probably might be faulty. So you have to look at it. There's a series of tests that you have to do to find the cause why you're having high levels of that hormone. And there are drugs that inhibit the organ from producing the prolactin, which will stop the breast milk from being produced. So I think I would recommend that you have further investigations to find the cause and then address it appropriately.
All right. So thank you very much. The time is fast spent. Just a couple of things that you can just.
And there was a last question.
Answer, answer that question, and then one about I think it's for Madam Lydia.
The teenager.
Yes, about the teenager. When is a good time for a teenager to wear bra? And then when should a teenager
okay, that was
exam? Yeah. So Dr. Korsah, go ahead, and then Madam Lydia would also answer that, and then we'll get announcement and then go on. Go ahead.
Okay, so above 2021, you can go for investigations like the ultrasound. That will be good for you. The ultrasound will be better for you than the mammogram. So you can, especially if it's not routine. We don't routinely do it for very young women like that, but we recommend for women who have family history, maybe a first degree relative like a mother or a maternal aunt has had breast cancer, or a number of women in her family have had breast cancer. They are likely to start their screen at a very early age, but usually the teenagers, we don't do the ultrasound or those routine investigations for them.
Okay.
Thank you.
All right. And then Madam Lydia, please, are you around?
Yes, I am.
Yes.
Okay.
When is a good time for a teenager to wear a bra?
Okay. In the past, many years ago, you would have said from 13 and above, but now young girls are developing at very tender ages. So I would say, depending on how voluptuous the child is, you can go for a child can wear a bra from even age 10, depending on how well endowed they are or how endowed they are. So and even if they don't have big breasts, you can give them a bralette. You know, the bralette is the little flimsy one, which is quite stylish, but you are introducing a bra to the child so that they know how to cover their nipples, they know how to start getting support. But if they are busty, you can go for a no-wire bra. There are so many molded bras. The no-wire bras used to be very, very ugly looking, but now there are some very trendy ones which do not make the child look too grown up. However, if they are very, very busty, if their chest is rather heavy, you may need a minimizer for them at an early age. And then when they're going to bed, or just introduce them to sports bras, the racer back bra, which has the cross at the back, like the Y, the straps come together to form a Y. That will support the breast. Some children are even put in sports bras to go to bed. I don't know if the doctors will advise that, but in order to have the child grow up with good breasts, like good support, you start them at a tender age without the wires, but a bralette or a sports-like bra. Also, somebody asked a question about specialty bras, about mastectomy, if you've had surgery. There are specialty bras, and those bras are now very common. Before, you didn't have those bras, but they're made with pockets. So to allow you to put the prosthetic in there, or There's people who haven't even had surgery and they buy those bras with the pockets and put padding in there just to give them enhancement instead of going under the knife. So I hope I've answered the questions.
So thank you very much. Just a couple of questions I just wanted to talk about. Someone said that they had referred someone, a client with a lump, to a hospital, that they were told to, after examination, to go and come back in 6 months. We are talking about breast lumps, but not every lump is a cancer. What is important for you to be able to distinguish whether it's cancer or not is to go to hospital and have it examined. Go and see someone who really, go and see a doctor who knows what they're doing, and then let them examine. Okay, so it doesn't, just because they have a lump, it doesn't mean it's cancer. But if you have a lump, make sure you go for a professional to see. All right. And another question was that some say that mammogram itself can cause cancer. That is not a fact, I would say, because it depends. Okay, Dr. Sandra, do you want to take that? And then we wrap up.
Okay, no, mammogram actually are low energy X-ray. So as I was telling you, for any radioactive substance to cause cancer, it must be ionizing. So X-rays are ionizing though, but for mammograms, they are very, very low energy levels of X-rays. So the risk is very, very low. But so in medicine, there's always something you weigh the risk and the benefits. So the risk from mammogram is way, way low as compared to the benefits you get. So we still recommend it, even though it's an X-ray, but it's a very low energy X-ray.
Yeah, okay. All right, thank you very much. And I see we have people from all over joining us. We have people from Nigeria, from Ghana, from all over. So thank you very much for joining. I think at this time I'd like to invite Susan Hemina to give us a vote of thanks, and then we'll call it a night. Is Susan available, please?
Yes, I am.
Please go ahead.
Yeah. Okay. Thank you very much, Dr. Banka, for moderating this. And thank you all to all our participants. I think it has been a very enlightening session with us. We've gone over time and we are grateful for your patience. Just a bit of an invitation to all of us to join the Breast Society of Ghana. The Breast Society of Ghana is a non-governmental organization which was established in 2008. And we aim to serve as a national coordinated platform for excellent breast care in Ghana and hopefully across the globe, because looking at how our participants are global, we expect that very soon we'll become global. The society is made up of medical practitioners, survivors, and all persons, all manners of persons who are very passionate about breast cancer and breast care. And we are joining and treating all of you to join us. You can go to our website, which is www.ghanasociety.com, and you would see how you can become a member of the Breast Society. The Breast Society's core focus areas, we have our global message, which is a joint action for breast care. And we have 4 strategic areas that we are working in. One of them is advocacy and awareness, where we promote public education and policy engagement on breast health. Another focus area is breast screening, where we facilitate early detection through screening initiatives. And then we also have the research, where we partner with like-minded scientific institutions to advance studies in breast cancer to enhance prevention and treatment. And also we have our education and capacity building, where we train healthcare professionals and empower communities. And as you can see, this online public lecture is one of our advocacy and awareness strategic areas that we are working on. And we would like to invite all of you, because we've had very engaging sessions. So we would like to invite all of you to join us. When you go to our website, you'll be able to see how you can become a member. You are all welcome to join us. So this is our call to action for all of you that have have participated in this online public lecture today, that you can also join us so that collectively we can fight breast cancer and give hope to our patients and survivors. On that note of calling to join you, also on the screen, on the screen we have our numbers, which is 055. If you're dialing in from outside of Ghana, it is +233 559 994 747. And our Gmail, our address is ghbreastsociety@gmail.com. So that is also on the screen if you want to contact us. So we look forward to hearing from all of you, either through email or WhatsApp or even on our website. We look forward to hearing from all of you. Thank you very much. And on that note also, just permit me to make a couple of announcements. First and foremost, to apologize for all the technical hitches that we've had. We hope that the next public lecture, we would resolve all our issues and it would not happen again. Some of them were beyond our control, but we are grateful that you still stuck with us throughout the presentation. With regards to whether we will share the videos, yes, we'll put them on our various social media pages on Instagram, Facebook, also on our website. And for those of you who are members of Breast Society of Ghana, it would also be on our WhatsApp platform. So you get it. So for all of those who are not on our platform, you can check out our Instagram and Facebook pages, and you would find the video over there as well. And we would also like to inform all of you that our next public lecture would be held in September. Once again, we would also give you advance notice. We'll send out the flyers, and we hope that, again, you will join us for that in September. And on the back of that, I want to thank all of you for participating in this public lecture. I want to thank our speakers, Lydia Bampoe, Dr. Korsah, Jacqueline Oduro Akoto, and also Dr. Banka for moderating and for giving us such great insights into braziers and the effects of braziers on our health, and the fact that for demystifying the fact that braziers does not necessarily cause breast cancer. So we say thank you to all our speakers and to our moderator. And to you, our participants, thank you so much for making the time. I mean, this is a global group. We have participants from Ghana, Kenya, Tanzania, Nigeria, UK, and the US, and I guess elsewhere. Thank you so much for making the time to join us. We hope that it has been an insightful experience for you. And to the BSOG members, Breast Society of Ghana members and the executives, thank you so much for putting this up, for really giving us a very insightful educational session today. Thank you all very much, and God bless us, and have a good night or good morning wherever you may be, or good afternoon. Thank you very much.
Thank you. So thank you very much. And the information is up here, so please make sure that you've written it somewhere. And then we look forward to hearing from you. All right. And may the Lord be with us and keep us in good health. In Jesus' name, amen.
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 Amen. Amen.
Amen. Thank you.
Amen. Thank you.
very much.
Bye.
Bye.
Thank
Thank
you.
you.
Very,
Bye.
very, very useful. Thank you.
Bye.
Thank you, and may God bless you.
Thank you. God bless you.
Bye
Bye.
bye. Bye. Bye bye.
Bye.
Bye. Don't bite them.